Help us out. All right. You guys.
Today we're going to focus on what every American family, every American business is a stakeholder in, and that is health care. Next week I'll be returning back to Washington as Congress goes back into session. As we all know, health care legislation will be the #1 priority of the House of Representatives. My position on health care should not be a mystery to anyone here. Earlier this year, I introduced legislation to amend the U.S. Constitution, House Resolution 4, the Health Protection Amendment that would make health care a right for all citizens of the United States. I believe strongly in this goal. Universal health care coverage can make our great nation not only healthier and stronger, but more productive. Critics of making health care a right often say, well, we already have universal health care. People can go to the emergency room and access it if they really need it. That is the best example of why I believe our health care system in America is broken and it needs to be fixed. I want you to know tonight that health care reform is not a guarantee to be passed this year. There's a real possibility this entire debate could end with nothing. Why? That's because the opponents of reform are fighting to maintain the status quo. Fighting for the status quo is not about protecting people's health. It is about protecting billions in corporate profit. My Republican colleagues have made killing health care reform the center of their political agenda. Their reform proposals focus on doing nothing. Nothing to control costs, nothing to expand access, and nothing to improve quality. The same people who spent $1 trillion in Iraq after misleading our nation into that war now say it's too expensive to invest in the health of Americans here at home. The same people who wanted to privatize Social Security are now labeling government-sponsored care, Medicare, and our veterans' health care, quote, socialized medicine. The same people who attacked President Obama's goals for health reform are standing shoulder to shoulder with those in the insurance industry that would dump sick policyholders and continue to collect billions in profits. I believe the time has come to put people before profits. If you love your doctor, and right now I'm loving mine a lot, just had surgery Friday, and you like your insurance, your current insurance, nothing needs to change for you. Keep what you have. I support a public insurance option that will increase competition in the marketplace, keeps premium costs down, and provides for affordable insurance for all Americans.
I think it's extremely unproductive to talk about the Republicans blocking this thing. I'm an independent. I detest this bill. I think there's a lot of pathological lying going on in this debate. I think we need to take a lot of time to do this right, as that gentleman said back there. We're in an economic crisis today. We're not primarily in a healthcare crisis. We're in an economic crisis, so much so that the Chinese are advising us how to run our economy. That's a disgrace. We need to get real about solving our economic problems, getting people back to work, getting the country solvent, and then we can talk about healthcare. Thank you very much.
My firstborn ended up in Children's Hospital when she was 1 month old, and they told her she was going to die. Luckily, I had health insurance, good health insurance through my wife's employer, and they paid the bill, and today she's still here. And what I fear is that under a government-run policy, she would not be here because the general consensus among all the physicians was, her life's not worth saving. But you know what, since your insurance policy will keep her in the ICU, we'll keep her in the ICU. And that scares the heck out of me. There are other options besides the options they're putting on the table. If the biggest concern of most people is losing their health insurance. Why? Because it's tied to your job.
My hope is that you make some changes, some simple ones, like instead of public option, which sounds like a financial term, maybe call it public choice. People like choice. They want choice in their life. They're afraid of options. And
I have my own business. I have a wife with lupus. I have a 16-year-old daughter that's blind in one eye. I pay for my own insurance. And I must be a strange guy. I think that's my responsibility. I kind of look at it as my responsibility to take care of my family. The state should be basically taking care of things. There's supposed to be 50 glorious experiments going on here, not the federal government mandating and dictating everything that we do.
I have a basic distrust of government, not just when my guy isn't the one in charge. We're all Americans, and it shouldn't be that every 4 years, half of us are unhappy.
I was listening with interest. Your enthusiastic, your interest in that we would turn out, we would come and express our opinion, and how you were looking forward to hearing our comments. And I had to remind myself that had your party had the votes a month ago, there would have been no input from anybody. You guys would have rammed it through without any discussion, without even seeing the bill on the internet. There are so many mandates that raise the cost of health insurance. Take those out, allow smaller companies to come into the state, allow the insurance to be portable. When you leave your job, you can take it with you, like the gentleman said before. Let each person get a cash amount from their employer and let them go around and buy their own health insurance.
Well, I appreciate you sharing your views. However, there was no piece of legislation that was being rammed through anywhere. I know that I started to read parts of the bill, and I was kind of surprised to read the grandfathering clause that really, when I read that, looked to me like I would not be able to keep my health insurance. Maybe for a year, maybe a little bit longer, but with the way that it talks about grandfathering, and if there are any changes in your plan, that you would then have to go into the public option.
Early on, we heard about the high profits of corporations. I want to remind everyone that corporations cannot take your money. Corporations cannot take your property. Corporations cannot take your liberty. Only government can take your property, only government can take your liberty, and only government can take your money.
I do go to Tea Party meetings because I'm extraordinarily concerned about this debt that's choking our country. I am grassroots, real grass from my backyard. No one sent me. No party sent me, no company sent me. It's just me. And I believe, first of all, I would really like to ask you to talk to your House leadership and tell her to apologize to people who disagree with her and not call them evil mongers or Nazis or any of these other crazy things that have been called simple people like us who are concerned.
Same identical CPT code, one being performed in a hospital, one being performed outpatient. The difference in cost was about $30,000. And it took me 4 months to even get that information. My doctors don't know what things cost. That's not their responsibility. What I have to do to go get cost is, quite frankly, amazing.
All people agree that reform needs to take place and that everybody should be covered. And you mentioned a time or two this evening that the Republicans are just stonewalling everything. Well, I'm holding something here which is from Senator Tom Coburn. And he summarizes his point that he's introduced the bill along with several other senators for choice for every American without raising taxes or increasing spending. In fact, one bill would save taxpayers at least $70 billion. Many other members of Congress, both Republican and Democrats, are working on alternatives that will herd the American people away from a government-run program.
Yeah, well, thank you very much.
Just stay positive. We're behind you.